So, Dr. Artsy, you can take it away.
Good, thank you. So thank you so much for joining me today to learn more about a science-based nutritional approach for managing ADHD. My name is Dr. Gali Artsy, and I'm the Medical Affairs Director at Vayarin, the maker of lipid-based prescription medical foods that are clinically shown to safely and effectively manage nutritional imbalances associated with ADHD and early memory impairment. In the session today, we will focus on our products for the management of ADHD, Vayarin, and I will start with a short introduction on ADHD and the unique dietary needs of kids with ADHD. So it is normal to have some inattention, unfocused motor activity, or impulsivity. But for children with ADHD, these behaviors are more severe, occur more often, and interfere with or reduce the quality of how they function, both socially and at school. So the symptoms of ADHD vary from person to person, and while there is no cure for ADHD, the treatments that are out there today can help with reducing some symptoms and improving functioning. And ADHD treatments, and you have seen some of them today, include medication, psychotherapy, education or training, or any combination of these. Unfortunately, the possible role of nutrition is often not considered as part of the standard ADHD evaluation and management, despite its fundamental role in the optimal brain functioning. And clinical studies actually link ADHD with several nutritional deficiencies. For example, vitamin deficiency, lower levels of vitamin B6 or zinc are seen in ADHD children. Other studies found mineral deficiencies. For example, 9 out of 10 ADHD children are low in magnesium. And most importantly for our discussion today are omega-3 deficiencies. There is a growing evidence that kids with ADHD have lower levels of omega-3 fatty acids. And in this, I'll take it one step back. So in this graph, you can see the levels of omega-3 fatty acids in kids with ADHD as compared to their control counterparts without ADHD. And here we can see two of the most important omega-3 fatty acids in the blood of those individuals with ADHD as compared to their control group. And the results show that there is a deficiency in these two fatty acids, EPA and DHA, in the ADHD group as compared to their control counterpart. So here you can clearly see the connection between the omega-3 deficiency and ADHD. And this is just one study, but there are more than 15 different publications pointing to the same correlation: lower levels of omega-3 fatty acids in individuals with ADHD, kids, adults, males, and females. So omega-3 really matter, and the evidence isn't just in our blood. Interestingly, some studies have shown that kids with ADHD may present more visible symptoms of omega-3 deficiency, such as excessive thirst, frequent urination, very dry skin, and abnormal behavior. So obviously, when omega-3 levels are low, we just need to add omega-3 back to restore the balance, right? Well, it turns out it's not that simple. And there are different researchers actually tested the addition of omega-3 fatty acid, different dosages, different ratio between the omega-3 fatty acids, different sources into the diet of people with ADHD. And the results were inconclusive, some of them even negative. What our researchers at Vayarin thought was that maybe these omega-3 fatty acids weren't getting through the brain enough to restore the balance. So the omega-3 levels are deficient, but just delivering omega-3 is not enough because they are not getting to the brain in an efficient way to restore that balance. So they started looking for different ways to get more omega-3 to the brain. And what they found, and you can see it in this graph, that by attaching the omega-3 fatty acid to another type of lipid that is called phosphatidylserine, or in short, PS, when you're attaching this PS, this other lipid, to the omega-3 fatty acid, you can actually help them to get where they're actually needed the most, the brain. So when you're attaching one lipid, omega-3, to another lipid, phosphatidylserine, you're basically creating a carrier that will lead the omega-3 directly to the brain. And in animal studies, and here you can see one of those studies, the researchers compared this bonded composition of PS attached to omega-3 to other over-the-counter dietary supplements containing just omega-3 by itself, just phosphatidylserine by itself, a mixture of the two of them but not attached, just mixed together, versus our unique attached molecule, where those two lipids or fats are attached to the same molecule. And the results were very interesting because they showed that this unique composition of phosphatidylserine attached to omega-3, which is the active ingredient in our molecule, Vayarin, resulted in the largest accumulation of omega-3 in the brain of the rat. And we're talking about 42% more omega-3 in the brain of those rats after administering this unique conjugation of PS attached to omega-3. And that's basically how Vayarin was born. Vayarin contains a unique composition that addresses lipid imbalances that cannot be managed by modification of diet alone, or as I showed you, by taking other dietary supplement. The effect is just not comparable, not in terms of the penetration of omega-3 in the brain, and not in the clinical effect that is seen in ADHD children. So in that point, I've showed you that Vayarin is a unique composition, and I showed you the advantage in animal studies. But what about people? So Vayarin's safety and efficacy were evaluated in a clinical study of 30 weeks. In that study, children with ADHD, 200 children between the ages 6 to 13, took Vayarin versus placebo, and their performance was measured using questionnaires given to both their parents and their teacher. Vayarin was clinically shown to reduce several ADHD behaviors, and you can see it in this graph, the reduction of different symptoms according to both the teachers' and parents' questionnaires. And it was particularly seen in ADHD children that also had emotional dysregulation. So the entire cohort with ADHD benefited from Vayarin, but this specific group of emotionally dysregulated children kind of benefited across the board in different ADHD symptoms according to both parents and teachers' evaluation. Emotional dysregulation is an overall emotive response that is poorly modulated, and it's shown up in both external and internal behavior. Some signs of emotional dysregulation include difficulty calming down when upset, mood swings, oppositional behavior, and more. Emotional dysregulation is a particular component of ADHD, and it is unaddressed by the prescription drugs for ADHD. So how common is emotional dysregulation? Emotional dysregulation is seen in up to 45% of patients with ADHD. They have some form of emotional dysregulation, along with their other ADHD symptoms. Emotional dysregulation may be evident mostly in the edges of the school day, when it's time to get ready to school, or when the child comes home, and this may be why the treatments that are focused on academic performance do not fully address this aspect of emotional dysregulation. What are the types of patients that can benefit the most from Vayarin? So there are two major groups of patients that can benefit from Vayarin. And the first group are ADHD patients who are intolerant to other treatment they've already tried, or patients that are reluctant to start new treatment due to different reasons. So for these specific patients or children, Vayarin may be used as a standalone approach for managing ADHD. The second group includes patients whose emotional dysregulation, as I mentioned, is not fully addressed by the ADHD medication that they're already taking. And in these cases, Vayarin can be added to the existing treatment. Vayarin is safe, well tolerated, and no contraindication with any other ADHD medication, stimulants or non-stimulants, have been observed. So now for some technical details about the product. Vayarin is a prescription medical food, so only the healthcare provider can prescribe Vayarin, and it should be used under the ongoing supervision of a physician. The recommended dosage of Vayarin is 2 capsules a day, or as directed by a physician. And the capsule is specifically designed for children consumption, so it's a very small capsule and can be also opened and sprinkled on food. It is very important to know that because of the way that Vayarin works in the body, it can take between 1 to 3 months to actually see the full benefits of Vayarin, and specifically, as I mentioned, in the emotional dysregulation field. And that's it for the presentation, but I would love to take questions.
Thank you so much.
Sure.
All right, we do have a couple of questions. The first one is, why does it take 3 to 4 months to start working?
That's a great question. So Vayarin is very different from other medications for ADHD. It's a medical food, and as a medical food, it works as a building block in the brain. So it takes time until it reaches the desirable level or amount in the brain, and it depends on what is the severity of the lipid deficiency, and every child we know is different in terms of the deficiency, in terms of the metabolism, but it takes approximately 30 to 90 days to see the effect of Vayarin.
The next question is, does Vayarin have a risk for allergic reaction due to contents?
So Vayarin, the source for Vayarin is krill. So for patients that are allergic to krill or shellfish, Vayarin is not recommended. Other than that, it does not contain gluten or dairy product, soy or fish.
Would Vayarin be indicated for children with coexisting pandas?
So Vayarin is primarily indicated for ADHD. For any other disease or disorder, the patient, of course, the caregiver should consult with the healthcare provider in order to understand the additional disorder or symptoms. But Vayarin was only studied in patients with ADHD, not with other comorbidities or diseases.
Does insurance typically cover Vayarin?
So that's another good question. So Vayarin is not picked up by insurance company. It's very anecdotal. So several insurance companies do pick up Vayarin, but it's not very robust. So it should be checked individually.
Okay.
And
we put something on your website, though, right? That there's a way to...
Exactly. So you can find, that's exactly what I wanted to mention. You can find more information about ways to purchase Vayarin through our website, and you can see here that vayarin.com. So you can find there physicians that can prescribe Vayarin and specific discounts for Vayarin. So.
Okay, what would the typical cost, the question is, what would the typical cost be if they went that way?
So there are 2 channels by which you can get Vayarin. You can go to different pharmacies, and then the price varies, and we don't have any control on the price, and it's anywhere between $55 to $85 per month. Another option is to go to our online pharmacy. We have an online pharmacy that is called ViaDirect, and then the price for Vayarin is $54.50 per month. And for the first 3 months, because as I mentioned, it takes approximately 3 months to see the full benefit of the product. So through our online pharmacy, the 3rd month is free. So it's basically you're getting 3 bottles for the price of 2.
Thank you. Okay, there's a couple more questions if you have a couple more minutes.
Sure.
Should the 2 capsules be taken at the same time or spaced apart?
So both options are good. You can take one in the morning or one in the evening, or you can take 2 at the same time, as long as you're compliant. So whatever works for your specific family works for us. In terms of the specific half-life of Vayarin, it doesn't really matter. You can take 2 at the same time or split a dose. It will not change the efficacy or the stability.
Okay. In some cases, it needed to take more than 2 per day?
Yes, and this is up to the decision of the physician. Our recommended dose is 2 capsules per day, but as I mentioned, every child is different. It depends what's the severity of ADHD, additional diseases or disorders, and this is why we leave it to up to the decision of the physician if to increase the dosage of Vayarin for specific cases.
Okay. I'm seeing the recommendation of 2 to 4 milligrams of EPA for ADHD. What is the Vayarin content ballpark for omega-3?
Another very good question. So Vayarin is not an omega-3 product. Vayarin is a phosphatidylserine attached to omega-3. The amount of omega-3 in Vayarin is significantly lower than what was mentioned in the question. And the reason to that is that Vayarin is a targeted delivery platform of those omega-3 to the brain. And on top of the omega-3 that are delivered very efficiently to the brain and are not just absorbed by other parts of the body, Vayarin provides phosphatidylserine, which by itself is a very important component of the cell membrane. It's important for brain functioning, communication between nerve cells, and more.
Is there any difference in research data for older kids or younger children?
So our study was done in kids between the ages 6 to 13. There was no difference in the dosage in this specific study. We're now in final stages of another study in adults with ADHD, and there we will learn more about the dosage for adolescents and young adults and adults. But currently for 6 children between the ages 6 to 13, the recommended dose is 2 capsules per day without any difference.
There's a follow-up question about boys versus girls. Do they just respond any differently, or are they the same?
Great question. So boys responded actually a bit better than girls. Just because in this specific study, the boys were more diagnosed with hyperactivity, impulsivity, and emotional dysregulation. And as I mentioned, these are the areas that Vayarin was shown to be mostly effective in. So boys kind of responded better, yes.
Good to know. Okay. Here's a simple one. Can it be mixed in juice?
It can, but it can be a bit clumpy in juice. It's a powder, so we recommend to sprinkle it on applesauce, for example, ice cream, and these textures of food, not specifically drinks.
Are there any contradictions, or are there any conditions Vayarin is contraindicated for?
No, but it was not studied in other conditions or health disorders besides ADHD.
Okay. And are there any supplements that should not be taken with Vayarin?
Not that we know.
Okay. Those are the questions that I have.
Yeah.
Thank you very much for spending a little extra time with us and answering all of those questions. We really appreciate it.
Sure. Thank you for having us today.
Yeah.